Dr. Gerr is MD from State University of New York Medical School in Stony Brook, New York. He joined the University of Iowa in 2002 as a professor in the Department of Occupational and Environmental Health, having previously served as a professor at Emory University Rollins School of Public Health. Dr. Gerr has had an illustrious professional career. He has authored over 120 journal articles and book chapters and received over $18 million in research funding as a principal investigator or co-investigator, including serving as the PI of the National Institute of Occupational Safety and Health funded Great Plains Center for Agricultural Health. He has served as a mentor and dedicated teacher, having directed the Occupational Medicine Residency training program in the College of Public Health. But what separates Fred is his lifelong commitment to and impact upon the health of workers. His research on occupational and environmental risk factors for neurological impairment and musculoskeletal disorders has contributed to the health and safety of thousands of workers in the U.S. and internationally. We are very pleased today to be able to honor Dr. Gerr for this truly distinguished career. At this time, I would like to invite Dr. Gerr to the virtual podium to present the 2020 Distinguished Faculty Lecture. Fred?
Hi, I suppose this is the time that I go to screen sharing. Good afternoon, and thank you all for joining us. Dean Parker, thank you very much for your very kind introduction. I would like at this time to thank Associate Dean for Research, Corey P. Gesa, as well as Jill Wiley and Deb Vensky for their assistance arranging and promoting this lecture. I'd also like to thank my colleagues who nominated me for this honor, the honor of giving this presentation today. And in addition, I would like to thank Professor Renee Anthony for her expertise, her encouragement, and her patience. Today, I'll be talking to you, as you just heard, about meatpacking plant workers, a case study in a precarious workforce. In the tradition of telling you what I'm going to tell you before I tell it to you, these are the topics I will cover today. Let's start by talking about precarious employment. What is precarious employment, and why does it matter to us? Precarious employment is a relatively new concept in public health, a point I'll get to in just a moment. And in general, there are two primary domains that people talk about when discussing precarious employment. One of those domains, contractual arrangements, is not our focus today. For contractual arrangements, think temporary work or gig work, like Uber and Lyft drivers. That's not especially applicable to meat-packing plant workers. The second of the domains, employment circumstances, is applicable. And I want you to look at these four characteristics of employment circumstances that define precarious employment along with me. First, low wage. That, I think, speaks for itself. Poor protection from being fired. Lack of access to social protection and benefits associated with full-time, or what is sometimes called standard employment. Now, this refers to, these social protections and benefits refer to things like paid time off, sick leave, access to other benefits such as worker compensation, and safe and healthy working conditions. Finally, employment circumstances includes lack of or limited access of workers to exercise their rights at work. And in this case, rights at work really refers to organized labor, that is labor unions, and collective bargaining. Why does precarious employment matter to us? Precarious employment is only recently recognized as an important public health concern. A PubMed search that I did just 2 days ago of the combination of precarious employment or precarious work produced 209 papers, the first of which was in the late 1990s. Relevantly, more than half of these papers have been published since 2015. A review of that literature, which I will not be doing today, indicates that precarious employment is an emerging social determinant of worker health. And depicted in the square on the right side of this screen, you can see this is taken directly from Healthy People 2030, 5 leading determinants, social determinants of health. While work presumably fits into economic stability with the dollar sign and perhaps built environment, interestingly, safe and healthy working conditions are not prominently featured here. Those of you wishing to understand more about precarious employment as an emerging social determinant of worker health are referred to the 2 papers that are provided here. Depicted here is a graphical model of how precarious employment affects both occupational and non-occupational health outcomes. And I know how much academics like this kind of graphical depiction, so I thought the presentation wouldn't be complete without one. Precarious employment, and again, always remember across this lecture, and hopefully forever, you'll remember the 4 primary features of precarious employment: low wage, job insecurity, lack of social protection and benefits, and inability to exercise rights at work. Precarious employment itself then becomes a risk factor for both injury on the job, disease on the job, injury on the job being occupational traumatic injury, disease being chronic disease, as well as occupational psychosocial stress. And this occurs because precarious employment includes as one of its characteristics work that is unsafe and unhealthy. Work that includes the presence of hazards that lead to injury, disease, and stress. They then become a positive feedback loop. An occupational injury renders workers who are employed precariously, increases their chances of being dismissed or discharged or fired from employment. The experience of an occupational disease as well renders employment more precarious. Hence, these arrows are in both directions. Now, here we are. Hence, these arrows are in both directions. Precarious employment, which includes almost by definition low worker control over the circumstance of their work, results in an increase in occupational, psychosocial, or psychological stress. Occupational psychosocial stress is also a known risk factor for both injury and disease, as well as for additional employment precariousness. I'll move on now to a quick overview of the meat industry. And what I'm focusing on here is the product of the meat industry. I'm not going to read every line here. That's a little tedious for all of you. But what I want you to pay attention to is the extraordinary amount of meat that is produced annually. These are all annual values. The incredible amount of meat that is produced annually in the United States. In addition, this is an industry with substantial annual revenues. Pardon me. Finally, also note that the majority, but not all, of the states in which meat processing occurs are relatively rural states. Now, this is a busy slide, but I'm going to call your attention to some important characteristics. So the previous slide was the meat industry product. This slide is the meat industry workers. Workers, of course, and their health are what I have been focusing on for the past 30 years of my career. The full left-hand column are descriptions, but then there's a column called US workforce, 152 million, give or take. And the next two columns are meat, slaughter, and process workers. The middle column is all such workers, and the right-hand column is frontline workers. Frontline workers are the workers who are doing the actual cutting, butchering, slaughtering, and processing of the meat. And those workers, about 192,000 of them, are my focus today. This workforce is predominantly non-majority. And if you look at the race and ethnicity, you can see that 81% of frontline meatpacking workers are non-majority, whereas only 37% of the entire US workforce is non-majority. Also relevant here is foreign-born. Just over half of frontline meatpacking workers are foreign-born, whereas less than a fifth of the entire US workforce is foreign-born. Note also that nearly half of frontline meatpacking workers live with a household income that is under 200% of the poverty line. As shown here, the annual average wage of frontline meatpacking workers is about $30,000 per year. So we see here that the sociodemographic characteristics of frontline meatpacking workers are the characteristics of people in this society who are typically disenfranchised and have insufficient political power. Now let's just combine the information we've seen on the previous two slides to begin our entry into an understanding of the hazards that are faced by these workers. Total meat production, 130 billion pounds per year in the United States alone. Frontline workers, 192,000. This results if each pound of meat is handled by one worker, one time, which is clearly an underestimate. This means that each worker handles almost 6 pounds of meat per minute. And by handle, we'll see exactly what that means in just a couple of minutes. If we assume, by the way, that cutting and trimming workers who must be involved in the processing of every pound of meat themselves represent 50% of frontline workers, then each one processes about 11 pounds of product per minute, or 4,400 pounds of product per day. Now, occupational illness and injury among meatpacking workers is not new. A number of you will be familiar with Upton Sinclair's book, The Jungle, 1906, in which he provides quite compelling descriptions of the crippling injuries and illnesses that are experienced by meatpacking workers. The New York Times published this article, Misery on the Meatpacking Line, June 14th, 1987. I found this when I was cleaning out my office on the Oakdale campus. I have a hard copy of this. I cut it out of the New York Times on June 14th, 1987. And my first thought when I looked at it was, well, that's not that long ago, until I realized that I was still in training in occupational medicine when that article was published. And now I'm emeritus. In April 2016, the Government Accounting Office produced a document called Additional Data Needed to Address Hazards in the Meat and Poultry Industry, in which, again, hazards faced by these workers were described. So this is more than a 100-year span. So in some ways, what I'm talking to you about is pretty well known, and it was known long before the nomenclature precarious employment ever became part of the public health vocabulary. So what are the hazards in meatpacking? A number of hazards in meatpacking have been recognized for a long time. The first I'll describe is forceful and repeated exertions of the hands and arms. Those of you who are familiar with ergonomics or have taken Nate Fettke's course know that forceful and repeated exertions of the hands and arms are the primary risk factors for musculoskeletal disorders of the upper extremities. And what I'm talking about here are joint, tendon, muscle, and nerve injuries to the hands, wrists, elbows, and shoulders. These represent a majority of the illnesses. These are chronic conditions. They're not injuries which occur instantaneously. These occur as a consequence of exposures over time. Heavy lifting and product handling is a known risk factor for low back pain, another one of the most important occupational ailments in the United States today. The hazards of sharp cutting tools speak for themselves. Other hazards in the meatpacking environment include microbiological contamination of product, exposure to disinfection chemicals, and slips, trips, and falls. But what I'm going to focus on today are really the musculoskeletal consequences of forceful and repeated exertions of the hands and arms, which result in musculoskeletal disorders, which represents a substantial, probably the predominant proportion of all illness and injury experienced by meatpacking workers. Now, I'm going to show some video of meatpacking work so that we get a sense of the hazards that are experienced by these workers. And you'll note in the lower right-hand corner, it says, warning starts here. Some of this video can be difficult to watch. So if you don't want to see video of meat being processed, and in a few minutes, if you don't want to see video of live animals entering meat processing facilities, this might be a good time to avert your gaze. I will let you know when these videos are complete. So what I want you to do now in general for the next several videos is watch the movements of the workers' hands and the use of tools, predominantly knives and meat hooks. Here we go. Now we'll take a look at a modern meat processing line. Depicted here are workers, and we'll get to this in a little while, but note the proximity of the workers to one another. That has no relevance, of course, when it comes to musculoskeletal disorders, but it will have relevance when it comes to airborne transmission of respiratory illness, which we'll cover in just a few minutes. Pay particular attention to the busyness of the hands of the workers on this line. Now, since I know you all like to have homework, what I want you to do is to count the knife cuts. I know I have a number here, but see if you can keep up with this. We're going to see a 13-second video clip here of the processing of red meat. Here goes. Note the speed that the cuts are made with, and note the proximity of the left hand to the knife blade. This is similar work. Again, count the knife cuts, but this is clearly poultry processing. So these workers are making between 12,000 and 24,000 forceful cuts per day. This is a video of a job that's called live hang. And what you're going to see here are live chickens being taken out of these yellow bins. These chickens will then be hung on this moving conveyor line. Count the chickens that are picked up by this worker. Let's do some quick math. This live hang job, these workers hang one bird every 4 seconds. It's 15 birds a minute. Birds typically weigh 5 pounds. Remember, they still have all their innards, they have their heads, their feet. That's 75 pounds of bird a minute for a 400-minute workday. These workers lift 30,000 pounds of bird per day. Even I couldn't believe it. So I went back and redid the math over and over again, and I just kept getting the same answer. Each live hang worker lifts the poultry equivalent of a Boeing 747 airplane every 13 days on the job. So surely, when we look at injury incidence, and here we look at injury incidence by severity, of poultry processing versus all private industry, we should see much higher rates of injury incidence among poultry processing workers than all private industry. These data come from the United States Bureau of Labor Statistics, which is part of the Department of Labor. And these data come from reporting by employers themselves. These are all part of the Bureau of Labor Statistics survey of occupational injury and illness, sometimes just abbreviated SOII. What we see here is that for all injury and illness, poultry processing workers in 2016 were just over 4 per 100 full-time workers per year. All private industry was just under 3. Well, that doesn't seem like that big a difference, does it? Note here, though, that the more severe injuries are in the darker purple color and the orange color. Those are injuries that result in days away from work or job transfer or movement restriction. The blue are those that required first aid, but not being away from work or transfer or restriction. In this case, we see nearly twice as many of the more severe injuries among poultry plant workers. But that doesn't tell the whole story. In fact, it is an open secret that the Bureau of Labor Statistics survey of occupational illness and injury underestimates the true burden of occupational illness and injury. Why is that? First, occupational illness, including musculoskeletal disorders, are captured poorly by the survey. This is a quote from a staff report, U.S. House of Representatives. Workers, employers, and medical professionals often fail to detect the work-relatedness of occupational disease. And that's because occupational disease doesn't come with a label. Occupational diseases are clinically indistinguishable from non-occupational diseases. And only by taking a careful inventory of a patient's work are we able to correctly attribute that illness to the work environment. But it gets worse. Precarious workers are less likely to report workplace injury and illness because of the potential adverse effect it has on their continued employment. And then finally, employers who complete the reporting forms for the Bureau of Labor Statistics survey have an incentive to underreport occupational illness and injury. This is completely well known. It's even well known to OSHA itself, that relies on the results of the survey. OSHA has indicated in writing that underreporting of injury and illness is substantially more common among meat and poultry packing plants than other manufacturing settings. And the two citations I have here come directly from OSHA. So, just what is the burden then of occupational injury and illness in meat processing? And the burden, in fact, is quite high. And I present here again, not a complete review of the literature, but simply an assessment of just a review of a couple of studies. Muslin et al. Prepared a National Institute for Occupational Safety and Health hazard evaluation report. This was at a poultry processing plant in North Carolina. 41% of the participants worked in jobs with hand repetition and hand force requirements that were above professional organization consensus recommendations. And in a moment, we'll get to the question, well, what about the OSHA standard for hand repetition and hand force? 42% of the participants met the study case definition for carpal tunnel syndrome. 40% had hand or wrist symptoms, and 57% had musculoskeletal symptoms other than the hand or wrist. So we're talking elbow, shoulder, and low back. Liebler and Perry evaluated self-reported occupational injuries among beef slaughterhouse workers in Nebraska. They observed that the all-cause annual incidence rate of severe, and that corresponds to the upper two categories of the bar chart that I presented just a moment ago, that severe injuries requiring time off, job transfer, or restriction, they enumerated 15.2 injuries per 100 full-time workers, which in the year that that study was done was more than twice as high as the Bureau of Labor Statistics severe injury rate for animal slaughtering and meatpacking in 2012. So it's pretty clear that the data that we have from national reporting mechanisms is a substantial underestimation of illness and injury experienced by these workers. Well, what about OSHA? The Occupational Safety and Health Act of 1970 established OSHA, the Occupational Safety and Health Administration, to ensure safe and healthful working conditions. Well, where is OSHA's standard for how much force is acceptable, how much repetition is acceptable? Just like they have how much noise is lawful, acceptable is the wrong word, lawful. How much asbestos exposure? How much lead exposure? Well, OSHA tried. In November 14th of 2000, this was announced in the Federal Register. The Occupational Safety and Health Administration is issuing a final ergonomics program standard. Yes, a standard designed to prevent the very kind of musculoskeletal disorders that occur as a result of forceful and repeated exertions with the hands and arms, the very kind of exposures that these workers in meat processing experience. OSHA spent years and developed an ergonomics program standard. I remember it. I gave testimony in front of Congress in favor of this standard. It was promulgated right at the end of the Clinton administration. And then this happened. In March of 2001, just a few months later, President George W. Bush signed a joint resolution of Congress and eliminated the ergonomic standard, period. Secretary of Labor, Elaine Chao, who, by the way, is now Secretary of Transportation, underscored the importance of addressing ergonomic issues in the workplace. and identifying areas of common ground in seeking a comprehensive approach. But, and this is a little mind-blowing, the Congressional Review Act that authorized Congress and the President to simply terminate the ergonomics program standard that had been lawfully enacted in November of 2000, the Congressional Review Act prohibits by law the Osha from creating a substantially similar regulation. Hence, no future standard addressing ergonomics can be proposed in the United States. Now for a perspective that I actually got from my colleague, Dr. Mark Schenker, occupational medicine physician at University of California, Davis, and no longer, but was the longtime director of the Agricultural Safety and Health Center there. So the federal government did bring its full enforcement authority to bear on the plight of meatpacking workers, and it did it right in our backyard, Postville, Iowa. On May 12, 2008, 900 Immigrations and Custom Enforcement agents descended on a meatpacking plant, the agri-processors meatpacking plant in Postville, and they arrested almost 400 employees, virtually all of whom were Latino. So think about it. There's a law that requires the Occupational Safety and Health Administration to ensure safe and healthful working conditions for workers. The workers at agri-processors were working in one of the most unpleasant and dangerous jobs in America, and the federal government did bring a tremendous amount of resources to bear on this. But instead of improving the working conditions of these workers, the federal government arrested them and put them in chains, quite literally. Oh, by the way, 900 ICE agents. I've never heard of a circumstance where OSHA even brought 9 compliance officers to a workplace, let alone 90 or 900. So this is what these workers experienced. They're working under incredibly unpleasant and hazardous working conditions. They are arrested by a federal government, which is empowered by law to protect them. And they are, as we see in this photograph, which was in fact published in the Des Moines Register, they are shackled and they are being brought to the grounds of the National Cattle Congress. And then their freedoms are restricted with ankle monitoring. So that is how our government has responded to the hazards of working in meat processing, which is work, as we saw early on, that is done by disenfranchised members of our society, a predominantly Latino and to some extent African-American workforce. As if all this weren't enough, in September 2019, pork plants were authorized by the Department of Agriculture to increase processing speeds. And in a remarkably Orwellian moment, an administrator of the US Department of Agriculture stated that the USDA reviewed and found that higher line speeds did not threaten worker safety. So that has been the story of meatpacking up until the winter of 2020. Who could have seen this coming? I ask. Coronavirus infects more than 1,600 workers at 4 Iowa meatpacking plants. Des Moines Register, May 5th, 2020. Well, I'll show you one person who claims to have not seen this coming. And that person is the Chief Executive Officer of Smithfield Foods, the world's largest producer of pork and the operator of among and perhaps the single largest pork packing plant in the world, which is in Iowa. This is from a letter that CEO of Smithfield Foods, Kenneth Sullivan, sent to, you may have heard of these people, Elizabeth Warren and Cory Booker. What no one anticipated is the scenario we're living through today. That is our harvest. I like that. What he really means here is our slaughter facilities could be threatened en masse by a global pandemic that threatens our ability to produce food. No one anticipated it, except, according to a very detailed report by ProPublica, August 2020, meatpacking companies dismissed years of warnings, but now say nobody could have prepared for COVID-19. In documents dating back to 2006, government officials predicted that a pandemic would threaten critical businesses and warned them to prepare. Meatpacking companies largely ignored them, and now nearly every one of the predictions has come true. Well, meatpacking companies are nothing if not industrious, so they started to advertise. This advertisement on the left-hand side by Tyson Foods was taken out in the Washington Post, April 26, 2020. And I put in bold here some remarkable text, because Tyson is saying here, the government bodies at national, state, county, and city levels must unite in comprehensive, thoughtful, and productive ways to allow our team members to work in safety without fear, panic, or worry. To work in safety without fear, panic, or worry, because that's how they've been working all along. Smithfield Foods, which I mentioned a moment ago, largest pork producer in the world, took out a full-page advertisement in the New York Times, and they're very proud of this ad. You can find it on their website. And they talked about that they are responsible and have integrity, and that cynics and skeptics call it old-fashioned. Well, the Tyson ad on the left, 2020, April 26th of 2020, government bodies. Well, one government body did notice this, because just 2 days later, that government body, known as President Donald J. Trump, declared that meat processing facilities were critical infrastructure and would remain open. The executive, DPA is a Defense Procurement Act, by the way. So this executive order relies upon interim guidance that has been issued by the CDC and Osha and has authorized the Secretary of Agriculture to take appropriate actions to ensure that meat and poultry processors continue to operate and that they do so consistent with guidance by CDC and Osha. We'll look at that guidance in just 1 minute. But what I want to call your attention to is two little things. One, I can't help but think that the loss of over 10 million of serving of beef was not particularly influential for this executive, given his known fondness for hamburgers. And even though I thought that irony may be dead as a consequence of the Trump administration, April 28th, 2020, the date that this executive order was issued, is also International Workers' Memorial Day, a day of remembrance of workers who have been injured or killed on the job. So this is a very brief overview of the interim guidance, and it has everything you'd think it would have. Face covering, engineering controls, administrative controls, education and training, screening and monitoring, managing sick workers. But when you get into it and take a closer look at the interim guidance, this is what it says. Configure communal work environments so that workers are spaced at least 6 feet apart, if possible. Modify workstations, if feasible, 6 feet when possible. Use barriers, if feasible. Analyze incentive programs and consider modifying them if warranted. Disinfect, if possible. Wear cloth face covering when social distancing is not possible or feasible. Here's the bottom line. Not a single word of the OSHA CDC interim guidance has the force of law. None of it's a standard and none of it's required. These are suggestions that are entirely and completely unenforceable by the Occupational Safety and Health Administration. So, how did all that work out? What I'm going to show you now are 3 separate maps with 3 separate working groups. The first group is food processing workers other than meatpacking workers. So these are people who package frozen foods. You see here the manufacture of frozen pizzas, people who engage in industrial and commercial baking. So this is food processing other than meat processing. And we see that there, as of October 20th, which is the last time I accessed these data, on October 20th, 2020, there were 12,290 cases among 438 processors. The crude period prevalence here is 2.8%. All right. We ought to compare it to all working people, but I don't have those data. If we compare it to the entire US population, well, that was around 2.5% at that time. Let's move on and look at farm workers who, even though they're not our topic today, are clearly employed precariously and are clearly disenfranchised and unempowered. 10,600 cases among 233,000 farm workers. The prevalence here is 4.6%. The one thing that these workers have going for themselves is the fact that their work is done out of doors, even though their living and transportation circumstances are often problematic with respect to the transmission of COVID-19. Now let's look at meatpacking workers. 192,000 meatpacking workers, 46,000 cases. The period prevalence of COVID-19 among meatpacking workers is 24%. 1 in every 4 meatpacking workers has tested positive for COVID-19. 1 in 4. The American Federation of Labor, Congress of Industrial Organizations, the AFL-CIO, as it's regularly known, sued over a lack of COVID-19 labor protections. On June 11th, the DC Circuit Court of Appeals declined their motion. And the current Principal Deputy Assistant Secretary, because OSHA has no director at this time, said that we agree that OSHA's existing statutory and regulatory tools are protecting America's workers. I can't help but think that the workers who are depicted by these red circles might disagree with the Principal Deputy Assistant Secretary's opinion. Well, OSHA finally did do something. OSHA fined Smithfield, the largest producer of pork in the world, $13,494 after inspecting its Sioux Falls, South Dakota, not Iowa facility. 3,700 workers, more than a third of whom developed COVID, and 4 of whom died. The $13,494 fine represents 1/1,000,000th of Smithfield's annual revenue. Imagine that you operate a company. Your annual revenue is $100,000. You break the law and you harm someone. An agency examines this and decides that you need to be penalized. Your penalty, 10 cents. That's the equivalent of this Smithfield penalty. Not to be outdone, or is it underdone? Iowa OSHA, because Iowa has a state OSHA plan. Iowa is not inspected by federal OSHA. It's inspected by the state plan. Iowa OSHA fined one meatpacking plant $957 for a record-keeping violation. In response, the ACLU of Iowa and a group of labor unions filed a complaint with federal OSHA saying that state OSHA has failed to do its job. Debbie Berkowitz, a former chief of staff and policy advisor at federal OSHA, was quoted as saying, "You just have this sense in Iowa. You just have this sense in Iowa OSHA of an agency that has decided not really to enforce the law, that their best course of action is to not do inspections." Those of you who follow the news know that this just keeps getting worse and worse. Tyson managers bet money on how many workers would contract COVID-19, published in the Des Moines Register and the Iowa Capital Dispatch on November 19th. And then in a new allegation on the right-hand side of your screen, lawsuit says Tyson officials lied to interpreters about COVID-19 dangers in the Waterloo plant. Interpreters were told to tell Spanish-only speaking employees that there were no confirmed cases in the facility and that the Blackhawk County Health Department had cleared the plant for operations. Both statements of which were false. Tyson CEO Dean Banks expressed his concerns and in fact suspended without pay the names of supervisors in the complaint about the betting, and then made a statement which is the mantra of the meat processing industry. Quote, "Our top priority is and remains the health and safety of our team members." It doesn't have to be this way. States that have their own OSHA plans, including Iowa, have the authority to issue what is called an emergency temporary standard. California has done it, and Virginia has done it. The emergency temporary standard gives state OSHA plans the force of law, not guidance, not suggestions, but law, the violation of which is criminal, law that will protect workers from COVID-19. Iowa could do it too, but does not have the will. We remember back when we were talking about musculoskeletal disorders, I had a slide called "As If All This Weren't Enough." This is a fact. On November 11th, 3 days after Donald Trump lost his reelection bid, the U.S. Department of Agriculture submitted a proposal to raise the line speed in chicken processing plants. Because if there's one thing these workers need, it's a higher rate of work, and more workers in the workplace. This is a lot of words, but I'm going to read this to you because I think this is important. This comes from a report, a truly important report by Workers' Rights Watch, a nonprofit group, from a report entitled "Blood, Sweat, and Fear. Workers' Rights in the U.S. meat and poultry plants." Unlike workers in many U.S. manufacturing sectors, most meat and poultry workers do not face employers' threats to move their plants to other countries where wages and workers are suppressed. Excuse me. Some analysts argue, however, that this fact does not block a third world strategy by U.S. meat and poultry industry. They contend that instead of exporting production to developing countries for low labor costs, lax health, safety, and environmental enforcement, and vulnerable, exploited, read that as precarious workers, U.S. meat and poultry companies essentially are reproducing developing country employment conditions here. So some of you may be familiar with the name Rudolf Virchow. The font of all knowledge, Wikipedia, describes him, I believe accurately, as the father of modern pathology and the founder of social medicine. Medicine is a social science. And by medicine, by the way, Virchow means medicine and public health. Public health wasn't a term that was well coined during his lifetime. Medicine is a social science, and politics is nothing more than medicine on a large scale. Students and scholars of occupational safety and health are familiar with the classic paradigm called the hierarchy of controls for eliminating, or I should say for reducing the risk of occupational injury and illness among working people. It's not clear, given the source, that is, the fundamental fact of precarious employment among people who are disenfranchised and disempowered, that the hierarchy of controls is the solution for their adverse health effects of work in the meatpacking and meat processing industry. So what are the pathways to empowering meatpacking workers and protecting them from the health hazards they face? I started this slide with these words. Inequity, I think for sure. Injustice, in my opinion, yes. Exploitation, and it would argue that's the case. Class struggle, well, there are some loaded words that first came into common use in the middle of the 1800s, and they were introduced, as you know, by a couple of fairly radical German political philosophers. At the policy level, at a minimum, we can support organized labor rights. We can support higher minimum wage. We can support legislation compelling full reporting of occupational illness and injury. We can empower Osha. We can support organizations that act on behalf of worker rights, like the ACLU, and we can support immigration reform. At the consumer level, we can advocate more fully that people know where their money goes. That completes my prepared comments. I think I have taken a little too much time. My apologies, but I am happy to address questions if there is an opportunity to do so. Thank you so much for your attention today.